Hello, I'm Dr. Hlatshwayo Davis, Director of Health for the City of St. Louis. On January 6th, after consulting local, state, and federal public health partners, the City of St. Louis Department of Health announced updated guidance for isolation and quarantine during the COVID-19 pandemic. Now, I know that this has caused a lot of confusion. You've heard one thing from the CDC, you've heard another thing from the local news, and you may be hearing things from our department that may be confusing. So I'm going to walk us through this and talk a little bit first about what is isolation and quarantine. So isolation and quarantine practices are a part of a comprehensive layered disease mitigation strategy to prevent the spread of COVID. Isolation and quarantine help protect the public by preventing exposure to a contagious disease. The goal of isolation is to prevent someone with COVID from transmitting it to others by separating them. Quarantine involves separating individuals without symptoms who've been exposed to a contagious disease, like COVID, to prevent them from transmitting it also. So in the updated City of St. Louis Department of Health isolation and quarantine guidance, the period of isolation or quarantine for a person with a positive COVID-19 test may be as short as 5 days, reflecting the CDC's observation that this is the most contagious time during infection, or as long as 10 days. It's really important that you actually go to our website. Don't go by what you're hearing from your friends on Facebook, on Twitter, or even in the news. Check our website for the details on what criteria is being used to make those determinations. We have given guidance on what to do if antigen testing is not available as well. So we've really tried to make sure that this is as clear and accessible for everybody. Now, if you are eligible to return to work or school or wherever you may be going after 5 days, back into the public in general, you have to continue wearing a face mask at all times for the 5 days following the end of isolation. If an individual in isolation or quarantine cannot wear a face mask properly, for whatever reason, the isolation or quarantine period is 10 days. You may consider this appropriate for preschool students as well, children who are too young to wear a face mask, as well as any adults who are medically unable to wear a mask. Again, I invite you to view the guidance in its entirety by visiting the City of St. Louis Department of Health website. Be well, St. Louis.